Mr. Thomas. My name is Nicole and I'll be your nurse today. Before we begin, do you provide consent to this assessment video?
Yes, I consent to being recorded.
Perfect. Thank you very much. May I confirm your full name and date of birth?
Gregory Thomas, December 7th, 1987.
Okay. And may I verify your medical record bracelet, your bracelet here with my medical record mark? Okay. And it does match. Thank you very much for that.
No problem.
Do you have any allergies?
No.
Okay. Do you have any pain?
No.
Are you in any discomfort?
No.
Any shortness of breath?
No.
Okay, all right. And what day is today?
Today is April 3rd, 2025.
Okay. And do you know where you are at this moment?
Currently in the urgent care.
Okay. And who's our president?
Donald Trump.
Okay. Thank you for that.
No problem.
And so, just to give you an overview about what we'll be reviewing, I'll be performing a cardiac assessment, an abdominal assessment, a mobility assessment, and cranial nerve. And cranial nerves. And so, we'll start off then by performing the cardiac assessment. Okay.
Mhm.
And so I'll be listening to your heart in different areas to see if or to detect any abnormal sounds and abnormal heart sounds. Okay. Prior to that, I am going to go ahead and kind of inspect your chest for any masses, any heaves, or any abnormalities with your chest, if you don't mind. Okay.
No problem.
And once I'm listening to, I'm gonna have a seat here. Once I'm listening to your heart sounds, I may go underneath your shirt so I can better hear your heart sounds. Okay. Do you have any cardiac history?
No.
Okay. Any family history of any cardiac problems?
No.
You don't take, or do you take blood pressure medication?
No.
Okay. No problem. And so all of this, if you were to answer yes, would kind of play into my assessment as well. Okay. And so you never experienced any chest pain?
No.
Okay. So with your permission, I'm going to go ahead and listen to your heart sounds. Before that, again, I'm going to go ahead and inspect here. Okay. All right. I don't see any or feel any detection of any masses, any chest masses or protrusions. I don't notice any abnormalities with your chest or sternum, and so I'm going to go ahead and start listening to your hearts as well. Okay. So I'm going to start off here, and again, this is going to be under the shirt. I'll start off here, the aortic, the pulmonic, the herbs, the tricuspid, and then the mitral, okay, or the apical pulse. And here I'll listen to your pulse rate, okay. I did confirm that one of my other colleagues had obtained your vital signs,
Yes.
right? Okay, and she reported back to me that they were all within normal limits.
Yes,
okay,
everything's good.
awesome. And so I am going to go ahead and listen then anyways to your heart rate to make sure everything's good. Okay, all right. So my stethoscope has been cleaned. Okay. What I am going to do is I'm going to go ahead and warm it for you because since I'm going to be placing it to your chest, I don't want it to be cold. I'll be listening with the bell of my stethoscope. So both sides are helpful in listening to different sounds. So I'll be listening to that, to the bell sound, or using the bell side for that. Okay. All right. So I'm going to start over here. So I'm here at the pulmonic. And again, what I'm hearing is the lub-dub, lub-dub, lub-dub sounds. Okay, I'm going to move to the herbs. Okay, now here at the tricuspid. down here. I'm gonna go ahead and go through the other side. Okay. And here's where I would listen to your heart rate. Okay. All right. And your apical pulse was 81, which is within normal limits, okay? Upon my assessment of your cardiac rhythms and I'm sorry, not your cardiac rhythms, but your cardiac heart sounds, I did not detect any heart murmurs. I heard that strong lub dub, which is exactly what I would want to hear in a normal assessment, so that's good. And just a little fun fact, the SA node, which is a sinoatrial node, is the pacemaker node of your heart. So just a little food for thought, okay? But again, so far so good pertaining to your cardiac assessment, okay? Since the cardiac also relates to the circulation and the circulatory system in your neck, I'm also going to be inspecting your carotid arteries, which are in your neck. Typically, in an emergency, when you're checking a pulse, you would automatically go to the carotid artery to see if you have a pulse or not. So I'm going to be listening to your carotid arteries to just hear the blood flow. I'm inspecting and I'm looking for the detection of any bruits. And what that is, it's a whooshing sound. It's like turbulent blood flow, okay? And or a thrill, and that I'm actually palpating for. That would be like vibrations, okay? Both of those would indicate a little further assessment, a detailed assessment, so I'll be looking for that. I will be listening to and palpating the carotid arteries one at a time. If I were to palpate both or occlude both, then you would pass out. And I don't want you to pass out, of course.
Yes, please.
Okay, so I'm gonna go ahead and take, first, I'm gonna go ahead and take a look. I don't see on either area, if you don't mind moving. Perfect. And I know that we can look straight, okay? I don't see that there's any abnormalities in the neck, but I am gonna go ahead and palpate the neck to see or feel for any masses. Okay, all right. And so I'm gonna go ahead and take a listen to your carotid arteries, okay? And I'll be using the bell of my stethoscope. Okay. No bruits. Okay, you can look straight. Okay, you're gonna take a deep breath and hold it. Okay, and you can let it go. All right, you'll do the same again on this side. Take a deep breath and hold it. Okay, and let it go. Awesome. Okay, so I did not hear any carotid bruits or feel any thrills. Sorry that I'm just kind of putting a, okay. I did not feel any thrills, which again were the vibrations that you would feel up against the carotid artery, okay? So we know that the carotid artery is one area that we would locate a pulse. There are other pulse areas in the body that I'm going to be assessing as well as part of my assessment, okay?
Okay.
So in this area, in the arms, we would have the brachial pulse, okay? When we're taking a blood pressure, we're basically kind of compressing the brachial artery to get the blood pressure reading, okay? So the brachial pulse is on the inner aspect of the arm, okay? All right. And we also have right along your wrist, okay, is the radial artery, okay? And that's where we would also evaluate your pulse rate too. Just gonna take a quick check on that. Okay. All right. This is great. So the radial pulse is essentially equal to the apical pulse that I took, okay? If there was any discrepancy where I would have a different number, then that would be a pulse deficit, okay? And then the way to calculate that, you may not need to know this, but we would subtract the apical minus the radial, and then that would be the pulse deficit, okay? And so, so that would be the radial artery, okay? And so I'm gonna go ahead and have you lay down, if that's okay, because I am gonna go ahead and assess your the other arteries here on your legs as well, okay? Okay, all right. All right. Okay. So there are other areas of the body that we would essentially check for pulses, okay? So we have the upper extremities that we already assessed. So now in the lower extremities, we have the popliteal artery here, which is in the back of the knee, okay? That we would also assess. We can detect a pulse here, or we would check for pulses. And also, I'm gonna turn around here. This would be the posterior lateral. Let me go ahead and the posterior lateral, which is on the inner aspect of the ankle. Posterior tibial artery is that area. Sorry, pardon. And so I'm gonna go ahead and don some gloves, and I'm gonna assess the dorsalis arterial artery as well, okay? The dorsal aspect of your foot. And so I would don my gloves, and so I'm gonna go ahead and take these off. Okay, great. Okay. And so the dorsal pedalis artery is right on the top of your foot, okay? And so we would check for, and these are pedal pulses that we would assess for, okay? And so we would kind of just put my hand right here to test for a pulse. Okay, and there are pedal pulses present. So now that I'm here, I'm also gonna check the capillary refill, okay, of your toes. And so I'm gonna squeeze your toes, just to give you a heads up. I'm gonna squeeze your toes, and I should see a discoloration in your toes, and it should kind of return back to normal. in about less than 2 seconds, okay? Alright. Alright, and that is assessing capillary refill. Okay. Alright, perfect. I'm gonna go ahead and remove the other one as well. Okay, alright. Checking again for pedal pulses. Okay, yep. Alright, and capillary refill. Okay, alright, perfect. Okay, now I'm gonna go ahead and get some hand sanitizer here. Okay, and so that essentially I've detected pulses in all of these areas. So far so good, okay, with that area of my assessment. Since you're laying down, okay, I am gonna go ahead and also transition into my mobility, okay, assessment as well. So if you don't mind bending this knee, okay, all right, and now we're going to continue on here and flex. All right, any pain?
No.
Okay, we're gonna go ahead and do the same on this area too, on this other leg. All right, perfect. Any pain?
No.
Okay, all right. So I'm gonna come around here, and if you don't mind, you're going to point your toes, okay? Against, yep, all right, give me resistance. Now you're gonna flex, against, perfect, perfect, all right. Okay, so you have strong reflexes pertaining to flexion and extension of the feet, okay? Which is normal, it's a normal sign. If there was any sign of any weakness, then we would again do a further assessment to look into that a little further, okay? And so, since we're laying down here, okay, I'm gonna go ahead now and move on to the abdominal assessment, okay? So I'm gonna go ahead and, if you don't mind, I'm gonna wash my hands and then I'll be right back. Okay. Okay, all right, I got some hand sanitizer, and I'm gonna go ahead and continue on with my abdominal assessment, okay? So with your permission, I'm gonna go ahead and lift your shirt, okay? And so with an abdominal assessment, the first thing that I'm gonna do is inspect. I'm gonna inspect your abdominal area for any scars, any masses. Have you had any surgeries?
No.
Okay. And so, are you having any abdominal pain?
No.
When was your last bowel movement? Was it today?
Yes.
Okay. Are you normally regular with your bowel movements?
Yes.
Okay. And so, I'm gonna go ahead and first inspect. The next thing that I'm gonna do is listen to your bowel sounds. And so I'm gonna go ahead after that and palpate, or percuss, I'm sorry, and then palpate, okay? So in just inspecting, I do notice that there is a tattoo on the right lateral side of your abdomen. I don't see any presence of scarring. I don't see visually any masses in the abdomen either. And so, go ahead. All right. And so I'm gonna go ahead and now, since I've inspected first, I'm gonna go ahead and take a listen. And so what I'm listening for, I'm listening to all 4 quadrants, and I'm listening for bowel signs, and the presence of bowel signs. Okay, if there's any absence of bowels, then I'll listen a little longer, okay? All right. Thank you. Okay. Alright, vowel sounds were present in all 4 quadrants. Now that I'm listening here to these areas, I'm also gonna listen to the abdominal aorta, okay, which is a pretty big vascular artery that runs right in the midline in the epigastric area here, okay? Okay. Okay. I'm gonna move on to percussion, and so I'm going to go ahead and tap my fingers in each quadrant, okay? Okay, and what I'm feeling for is vibrations, okay? And that essentially would come from the internal organs, okay? And so next I'm gonna do some light palpation. Let me know if you have any pain, okay?
Okay.
Okay. I didn't notice any abnormalities, any masses that stood out. I didn't see that or observe that you had any tenderness or any pain.
No.
Okay, so I'm gonna do a little bit deeper palpation, not anything that's gonna be uncomfortable or, you know, disturbing for you, okay? But please let me know if there's any pain. Okay. And I'm also going to assess the intervertebral cortex, which is right along here along the side. Okay. Any pain?
No.
Okay. Okay. Perfect. All right. So far, I have not heard any abnormal vowel sounds. You had vowel sounds present in all 4 quadrants. They were normal, okay? They weren't hypo, which is low vowel sounds, or hyper, where there was a lot of vowel sounds. They were pretty consistent, and essentially they added up around 28, okay, in total. So that's normal, okay? So I'm gonna go ahead and bring this down here. And so you can have a seat if you don't mind. Okay, do you mind actually standing up? Thank you, and facing me. And if you don't mind holding my hands, and you're gonna squeeze them, okay? Give them a good squeeze. Okay, so bilateral hand strength, I would say, is +5. They're pretty strong. Do you mind outstretching your arms? Okay, and then you're gonna push down for me. Yep, okay, good. And do the opposite up. Perfect. And so that was equally as strong. Do you mind shrugging your shoulders for me? Perfect. All right. And turning your head to the left. Yep. And to the right. Okay. And that is assessing the accessory cranial nerves. Okay. And so my assessment is kind of moving on to the next phase, which is the cranial nerves as well. Okay. And so you can have a seat. Thank you for that. All right. And so do you mind smiling? All right. Do you mind puffing out your cheeks? All right. Do you mind frowning? Okay. And showing your teeth? Perfect. And so that cranial nerve was the 4th, no, I'm so sorry. That was the cranial nerve 11. And so I am gonna go ahead and ask you to occlude one of your nostrils, okay? And I do have something here that I'm gonna grab here. Okay. So you're gonna include one of your nostrils at a time. Okay, and I'm gonna go ahead and bring this around. Okay, we're gonna go ahead and close the other one. All right. And were you able to smell anything?
Yeah, it smells like alcohol.
Yes, this was an alcohol pad. Okay. And have you had any nasal surgeries or any polyps?
No.
Any distortion with your smell?
No.
Okay. Or abnormality with smell?
No.
Okay. And so that was essentially detecting the cranial nerve 1. Okay. And so the next cranial nerve that we have is the cranial nerve 2, which is the optic. And so the optic cranial nerve, I see that you wear glasses. Do you go to the optometrist often?
Just for my annual.
Okay, and so I'm glad that you do. I bet at the optometrist, you use the Snellen chart, which is the chart that they have you read, and you look at the lines, and it'll assess whether you have 20/20 vision. So that essentially is part of the cranial nerve. They're assessing the cranial nerve 2. Okay. The next cranial nerve that I'll be looking for is 3, 4, and 6, which is the cardinal fields. Okay. And so if you don't mind, you can kind of face me. And so I'm going to move this pen in 3 areas here on the left, and then 3 areas here on the right. So you're just gonna follow the pen, okay? And what I'm looking for is any detection of nystagmus. And what nystagmus is abnormal eye movement. So I'll be looking at your eyes and how you're coordinating with that, okay? All right, so we're gonna start up here, and then down here, and then here, and then here, and then here, and then here. Perfect, okay. And so there was no detection of any nystagmus, and so far so good, okay? The next one that I have is the hearing test, okay? The hearing test essentially tests cranial nerve 8. And so that is, if you don't mind, you're gonna turn around facing that way, if you don't mind, okay? And you're gonna cover one of your ears. Let's start with the right, okay? So I'm gonna whisper a word to you, okay? And so you're gonna just repeat it back to me, just depending, of course, on what you're able to hear, okay? Dog.
Dog.
Okay. And so you're gonna do the same with your other ear. Cat.
Cat.
Okay. Yes. All right. Perfect. So that was assessing your cranial nerve 8. Okay. And so we, do you mind sticking out your tongue? Okay. And you're gonna move it from side to side. Perfect. That is the cranial nerve, the hypoglossal cranial nerve, okay? If you had any difficulty in moving your tongue, then that would be abnormal, and we would look a little further into that, okay?
Yeah.
And so, do you mind sticking out your tongue? Okay, and saying, ah, okay, perfect. So that essentially is testing for the oropharyngeal nerve, cranial nerve, and so that is assessing your gag reflex, okay? And typically with a tongue depressor, we would assess the gag reflex, but typically that's the cranial nerve that we would be assessing, okay? And so we did the shoulder shrugs, we did the arm grips, and the other ones. And so I wanna say that we covered most of them, if not all. So one last thing that I do want to see, and you're just going to stand and you're going to close your eyes, okay? Okay. So what I'm looking for is any swaying in the body, and I do see that his gait there's no movement or swaying of his gait. He has a strong stance. Okay, all right, thank you. And so we would see with that test if there was any imbalance with your equilibrium, okay, or any imbalance issues. which so far, everything was looking good, okay? Just a run through, we went ahead and assessed the 4 areas, which was your cardiac, your abdominal. We also assessed circulatory and your pulses, which we did, as well as mobility. I do want to check to see your spine. I almost forgot, okay? So you're gonna turn around and face that way, thank you. And with your permission, I'm gonna move your hair, okay? And I'm just, if you don't mind kind of bending over, I'm gonna go ahead and take a gander here of your spine, okay? All right, I didn't notice any curvature of the spine, any scoliosis, lordosis, or kyphosis. And so, any back pain?
No.
Okay, no problem. All right, and just kind of assessing here. No abnormalities within the spine or the bony structure here. All right, perfect. Okay, thank you for that. And all right, any questions for me?
No.
All right, well, thank you for your participation in this assessment. I do want to say that I did not find anything abnormal, which is great. Always go in for your physicals, and if you were to have any concerns, I would always speak with your provider, okay? But I truly appreciate your participation, and I thank you very much.
Thank you. I
All
appreciate
right, thank you so much. Have a great day.
it. You as well.